Have you ever wondered if staying up late affects your health? Yes, it does. Hello and welcome, my successful and healthy earthlings. Mihaela Ragushia, naturopath and founder of the Natural Health Podcast. And in today's episode, I'm going to go and answer just that question. Does staying up late affect your health? And we're going to go into and talk about chronotypes, especially the evening chronotype. And then we're going to go into the hidden dangers of staying up late and then 3 tips to reduce those dangers. And at the end of this episode, I'm going to give you the opportunity to join a health and success-oriented community by clicking below and joining the Natural Health newsletter. Welcome to the Natural Health Podcast, where we bring awareness to sustainable health in a business hustle space. Natural Health Podcast is perfect for the high-performing business-minded individuals who want to work with their biochemistry to achieve success and optimal health. It's Mondays with Mihaela. That's right, me. Thank you so much for tuning in. I absolutely love, and appreciate your support. On Mondays here, I provide you with simple, savvy, and sustainable health hacks to optimize your health. Today's episode is an absolutely amazing one because I'm going to be talking about staying up late. I mean, think about it. When was the last time that you stayed up late? And what I mean by that is staying up beyond your usual sleeping time. So if your usual sleeping time is, let's say, 10 p.m. and you have a few friends over, probably not social in your instance, it's probably business oriented where you get an email and you just have to smash it out and you stay up late till 11, midnight, 1, 2 a.m. And it's not your usual, it's not usually what you do. So staying up late and your health are directly linked together. You may come home from work, you say hello to your partner, spend a bit of quality time with your partner, have dinner, and then you are back on the laptop, what you've been doing for the last 7-8 hours. And on that laptop, you just get zoomed into this can of worms and you get this client, that client, got to finish this, all those admin tasks that you just don't have time for to do during the day. And next thing you know, you look at your watch or your clock and you're like, oh my gosh, it is 1 a.m. Well, that affects your health. Let's discuss first the evening chronotype. Let's go into that. And what do I mean by that? Because what is a chronotype? Essentially, a chronotype is the natural inclination of your body to sleep at a certain time, or what most people understand as being an early bird versus a night owl. So some people are either early birds or night owls, right? You know what you are because you either just get so much energy at night or you get so much energy in the morning. You know what you are and it comes out, and you probably know what your partner is. You probably know what your parents are, what your kids are, whoever is around you, your loved ones. You know if they're an early bird or a night owl. It usually regulates our sleep. It regulates when we wake up, when we go to sleep. That's the chronotype, right? It has an influence on our appetite, our exercise, even our core body temperature. It controls it. It's responsible for the fact that you feel maybe more alert at night or more alert in the morning. That's kind of what a chronotype is. And it varies person to person. Just because, in your family, you've had a chronotype of most people staying up late doesn't mean you're going to stay up late, right? But genetics are part of it, but it depends on genetics. It depends on your age, and so many multiple other factors are affected by your chronotype or your decision which chronotype you are. It can also be influenced by your geographic location, which is quite interesting, right? Because if you were born, let's say, in the northern hemisphere and you move to the southern hemisphere, I wonder if your chronotype would change, and vice versa. If you're born in Australia and you ended up moving to Europe or the States, that may affect your chronotype also. So as a general rule, most children, kids, have an early chronotype. And then beginning in adolescence, those teenagers, I think you remember when you were a teenager, you did not get up first thing in the morning. And if you did, you are a total rare case. Because what happens when you become, what happens when you become an adolescent, your chronotype gets pushed back, leading to that myth of, you're a lazy teenager. But it's so much more complex, where your chronotype actually changes throughout your life. So essentially, emerging there's evidence out there showing that chronotypes are linked strongly to your genetics, among other factors. But in particular, this gene called PER3 circadian clock gene has been tied to morningness. Some research postulates that the variation in chronotype might have been a survival technique that evolved in the hunter-gathering stage, which is quite interesting, right? So essentially they're saying that there's different chronotypes and different variations, and I've read this before in the sense of, if you were back in the days when you're hunter-gathering, half of your tribe will be morning people, and then half your tribe will be evening people. So therefore, they can look out for predators. They can look out for danger if there's any danger happening. So therefore, there's only a limited time that you're actually exposed to danger, maybe 2-3 hours, because the early people go to sleep, let's say 8 p.m. and wake up around 4 a.m. And then the late people will go to bed at, let's say, 1 a.m. and wake up about 10 p.m. So between 1 and 4, those 3 hours, you've got time to be exposed to predators. So it's a limited time compared to 8 or 10 hours, right? So essentially, it's broken down into the morning person and the night person, the early bird, the night owl, the evening chronotype, and the morning chronotype. But what I'm talking about essentially today is the evening chronotype, and how that may be dangerous to your health. So if you're an evening individual, which means you stay up late, or even if you're a morning individual and for whatever reason you stay up late, you want to keep listening, because I'm going to talk about the possible dangers. So let's get into the hidden dangers of staying up late. Such an interesting concept, because we have our own reasons why we stay up late. Like I said earlier, we may stay up late for work reasons, to finish off those emails, to finish off that task, that project that we've been given. Or we may stay up for social reasons, because, it's someone's birthday, you go out and you don't come home till 1, 2 a.m. Or you might just stay up because you can't sleep, or because your partner is an evening chronotype, so you stay up with them. Or whatever reason it is, staying up late can actually harm your health. So I looked at a study, which was quite interesting. The aim of the study was to look at chronotypes with diet quantity and quality of US women, and they wanted to assess whether dietary energy density, which is a robust predictor of metabolic outcomes, mediates an established chronotype, right? So essentially they looked at 432 women, which is quite interesting, aged between 20 and 76, and it was a whole year follow-up, right? So they looked at chronotype evening compared with morning, and they looked at the results, right? So results go as follows. Evening compared with morning chronotype was associated with poorer diet quality, including lower intakes of plant protein, fruit and vegetables. Evening chronotype was also associated with higher dietary exchange density at baseline. Dietary energy density was a partial mediator of the association between evening chronotype and poorer cardiovascular health. So essentially they concluded it and said evening chronotypes could contribute to unhealthy dietary patterns in US women, with higher dietary energy density partially mediated the relations between eveningness and poorer cardiovascular health. Behavioral interventions to reduce dietary energy density might mitigate cardiovascular disease risk in women with evening chronotype. So essentially this study in particular that I looked at women. And when you think about staying up late, there are certain behaviors associated with staying up late, and you would probably agree with this. And those behaviors include sedentary lifestyle. You're probably not going to the gym or running a marathon at midnight, right? You're most likely to be sitting right? In addition to that, because you want that quick energy, because sometimes you don't have that much energy at nighttime, you will go for that quick, dense, calorie dense, full of fat, salt, sugar meal, like ice cream, like potato chips, like chocolates, like lollies, because these are the things that are going to give you instant energy for you to continue writing that email, for you to continue doing what you're doing. So therefore, if you are staying up late, 1, you're sedentary, 2, you're eating high calorie dense food, 3, your intake is not consistent of, as mentioned here, plant proteins, vegetables and fruits. Who do you know, or do you eat a bowl of broccoli at midnight? No, you'll most likely eat a bowl of chips at midnight, right? Because that is the association. Because at nighttime, you are more likely to watch a movie and eat popcorn. At nighttime, you are more likely to need that high energy food. So essentially, this study looked at even chronotypes, and the link, that there's a huge link between having an evening chronotype and eating unhealthy, right? And when you eat unhealthy, in this study, it made a huge link with heart disease, cardiovascular health, right? And what is cardiovascular health? One of the biggest killers here in Australia and worldwide. So if you're thinking about reducing your risk of cardiovascular disease, don't be an evening chronotype. Or if you are an evening chronotype, watch out with what you eat at that time and how it affects your sleep. I mean, I didn't even go into in this episode, I didn't even go into the sleep effect of it, but I just spoke about specifically this study and looking at, the diet related to an evening chronotype. There's so many other things we can look into, and I might look into it in my other podcast episode. But what the purpose of this episode is to allow you to think a bit of being an evening chronotype. So staying up late is associated with eating junk food, which is associated with heart issues, right? So you don't want heart issues, don't eat that junk food, don't stay up late. It's kind of like a little domino effect. So let's go into 3 tips to reduce these dangers. And that's exactly kind of what I just spoke about now. Number 1 is diet, right? Diet. And the reason why number 1 is diet is because, as we saw in this study, if you're an evening chronotype, you're more likely to eat junk, especially at night, right? And that affects our sleep, right? So number 1 is diet. Make sure that, if you are staying up late for whatever reason it is, you stop eating at a certain time. So for example, for myself, I try my best, even if I am out, that I don't eat past 8 p.m. No matter what time I fall asleep, I don't eat past 8 p.m. And usually what happens is if I do stay up and I come home at 1, 2, I get hungry, right? But the key is not to eat, because if you eat, eating is a key trigger for your circadian rhythm, which resets it. You don't want to do that. Okay, but we'll talk about that further. The second one is to understand your sleep. You need to understand your sleep, how important your sleep is and how you sleep better and how much food affects your sleep, okay? Number 3 is lifestyle. Do you want to be an evening chronotype? Do you want to be a morning chronotype? I know genetics and so forth impact it, but there are so many other things like when you eat, how you eat, the temperature, and so forth that affects your chronotype. So if you want to control your chronotype and you want to be a morning individual, there are so many things that you can do, looking at your lifestyle and so forth. But there you go. I hope that this episode made a little bit more sense for you to understand the dangers of staying up late in accordance with your health. Look, if you know someone who benefit from this episode, please share this with them so they don't stay up late doing emails and they get to sleep and live a happy and healthy life with a reduction of cardiovascular risk. And this is particular for women also. Look, if you want to be part of a success and health-oriented community, click below, join the Natural Health newsletter, where on Fridays we provide you with so many absolutely amazing discounts, bonuses, research, and a summary of the week's episodes. If do what you do best, love, like, share the Natural Health podcast, and remember, the missing link between failure and success is your health.
content and information provided here is opinion of Mahela Raguse and is for information purposes only and does not constitute medical advice. It is not intended to provide medical advice or take the place of medical advice or any current treatment you're undertaking. Consult your own medical professionals for any medical issues that you may be having. This entire disclaimer also applies to any guests or contributors to the Natural Health Podcast. It is advised that you consult your doctor or healthcare professional in relation to any health concerns you may be having. Mahela Raguse does not take responsibility for any health consequences which occur from a person listening, viewing, or reading this content. Under no circumstances shall the Natural Podcast, Mahela Raguse, any guests or contributors to the Natural Podcast, or any employees, associates, or affiliates of Mahela Raguse be responsible for damages arising from the information provided on the Natural Podcast. By listening to this podcast, you agree not to use this podcast as medical advice to treat any medical conditions in either yourself or others. Please note, if you're taking prescription, do not stop your medication or start a new protocol, including but not limited to supplements, diet, lifestyle changes without consulting a doctor or healthcare professional. If you or any person has a medical concern, you should consult with your healthcare provider or seek other professional medical advice. Never disregard professional medical advice or delay in seeking it because of something that you have read or heard on the Natural Podcast or in any linked materials. If you think you may have a medical emergency, call your doctor or emergency services immediately. Neither Mahela Raguse nor the publisher of this content takes responsibility for the possible health consequences of any person or persons reading or listening or following the information in the educational content.